September is National Drug Addiction Recovery Month, and today we have Hometown Pharmacy joining us to share more about this important issue and how Hometown can help those struggling with addiction. Jenny, thanks for joining us. Why is it important that we do pay attention to drug addiction in Wisconsin?
So drug addiction affects everyone in our community, whether it is affecting the person themselves or their family members, our legal system, employers. It really affects everybody. And if we don't pay attention to drug addiction and the problems that become of it, we're not able to move on and focus on everybody's health and wellness.
So then Hometown has services that can help with addiction. Tell us about those.
We work hand in hand with both local prescribers and a telepsych company where prescribers can prescribe Vivitrol, which is a medication that will help patients who are fighting addiction. So those patients can see a licensed doctor or a telepsychiatry provider and then either come into our office or into our pharmacy rather, and they get their injection from the pharmacist so that they don't have to travel to see a doctor or schedule an appointment with a doctor. So they come into our pharmacy and then they get either their Vivitrol injection, or if it's a psychiatry medication, then they would receive their antipsychotic medication. So it's a little bit easier, I think, for those patients because they don't, like I said, have to schedule that appointment, and they can have it administered by a pharmacist that they know and are comfortable with.
And what other services do you guys have that can help with drug addiction?
We also have disposal pouches for people who may have medication left in their home that they're looking to get rid of. We can hand them a disposal pouch at no charge that would deactivate the medication and allow them to throw it into their regular trash. And then, as I mentioned before, we're also able to connect people with a telepsychiatry service because addiction does fall under the umbrella of psychiatry. So if they are having a hard time finding a provider within their community, which unfortunately is a very common problem right now, there is a very large shortage of psychiatrists in the state. We are able to connect them with a provider who's able to help them, and walk them along that path to getting healthy again.
And what kind of success have you seen from your drug therapy programs?
So I don't have any specific numbers. We're not, collecting data, but I can definitely tell you that the services we provide are more than just injecting a patient with a medication. Every time I sit down with a patient, I do go through information with them about other things that they, can use as tools to fight their addiction. And then I hear their personal stories, which is the most rewarding thing of all. I hear of people who have gone from pretty much nothing, losing family, losing friends, losing jobs, losing children, to going on to live healthy lives again. And it's pretty rewarding to see that. So although I don't have any numbers, the stories speak for themselves.
Definitely. Thank you, Jenny. You can learn more at hometownpharmacyrx.com.